OHCS through the OHCS gatekeeper or through the program analysis, the analyst for that program. And a contact list of all of the program analysts are available on our HSS main dashboard. It's also important to remember that each manual is specific to the program for which it was created, and nothing in the manual applies to other programs, and nothing in other program manuals apply to these programs that we'll be discussing today, unless it is expressly identified in the manual, such as the HSS Program Standards Guidance, which applies to all HSS programs. Information is not transferable between manuals. Again, if you have any questions, feel free to contact us. Generally, EHAP, whether through state general funds or the document recording fee, is designed to prevent and end houselessness. 25% of the program funding through the document recording fee is targeted to serve the veteran population. SHAP is designed to provide operational support for emergency shelters, and ERA is designed to prevent houselessness for those households in which there is a member age 58 or older. It is important to recognize that OHCS removed all the common elements of each manual and put them in a single location called the Homeless Services Section Program Standard Guidance, or the HSS Program Standard Guidance. These program standards apply to all homeless services section funding, and any failure to adhere to these standards will result in audit findings and may put the subgrantee's funding at risk due to non-compliance issues. Again, subgrantees can watch the training video we have on the required documents and program standards training for more information for those standards. Please be sure that subrecipients also understand this shift and that they follow the HSS program standard guidance. Additional clarity was provided on when a client service or housing stability plan is required. Case management is an essential part of services that are provided to clients. Having a plan for clients to stabilize their housing is required when a client receives more than one-time services. A plan is also required based on the type of assistance provided. If a client is receiving a hotel motel voucher as part of an emergency shelter strategy and receives more than 14 days of assistance in a fiscal year, and if a subgrantee or subrecipient is unable to assist a client with the totality of their funding request. In the case of not meeting the total need, a case plan should minimally document referrals to other resources that may be available for the client, either through resources that the subgrantee or subrecipient manages or other community resources such as Social Security benefits, TANF, SNAP benefits, food boxes, mental health, addiction services, etc. Clients do not need to have a housing stability plan when assisted in an inclement weather center or are temporarily staying in a shelter and receiving no case management. Applicants are eligible to receive EHAP General Fund and DERF when they are houseless or unstably housed and at or below 80% of area median income. AMI is derived from the home income limits that are available on the OHCS website. Clients receiving shelter services through EHA General Fund or DERF must be literally houseless. SHAP requires those seeking shelter services to be houseless. Under ERA, clients are eligible when they are at risk of houselessness and at or below 50% of AMI, and where at least one member of the household is age 58 or older. ERA is strictly a prevention program. There is a quick table on page 5 of the manual that highlights these basic eligibility requirements between the programs. Income must always include the current gross income of all adult members of the household. Income earned by minors or full-time students and who are not considered a head of household can be excluded. When we talk about household composition, excuse me, we mean either a family or individuals living together as one economic unit. A household must meet specific requirements in ERA and DERF, such as they must include a person age 58 or older for ERA, or when using EHAP DERF and using the veteran set aside, a household must include a person meeting the definition of a veteran. A veteran may be serving in active duty or discharged under honorable conditions, having received a specific award, received a non service connection pension for Veteran Affairs, or are receiving any benefit from the Department of Veteran Affairs. We have excellent veteran resources on our main HSS dashboard that grantees can use that includes training on how to document veteran status. If a grantee is unable to document veteran status at intake, grantees can take up to 12 months to obtain such documentation. However, it must be in the file within that time frame, and until that time, there must be documentation that the client is actively seeking that documentation. During monitoring, if such documentation is not in the file, the cost may be disallowed or require repayment. Housing status is aligned with HUD's definition for Category 1, literally houseless, Category 2, imminent risk of houselessness, Category 3, houseless under other federal statutes, and Category 4, fleeing domestic violence. The term homeless and houseless are interchangeable. A fifth category adds flexibility for those who are unstably housed, meaning either they are paying more than 30% of their income in rent, or they are paying more than fair market rent, or they are at risk of losing their housing and have been notified to vacate their current residence or otherwise demonstrate a high risk of losing their housing, and they lack the resources and support networks needed to retain their housing or obtain other permanent housing. It's important to document a client's housing status. When using Category 5, subgrantees and subrecipients must also document the lack of resources. However, that could be by self-certification, and there is a form on our website that can be used for such self-certification. Remember, self-certification must always be the last resort for documentation, and grantees must document their attempts at obtaining higher levels of documentation. Subgrantees or subrecipients must have policies and procedures in place that identify what income calculation method they will use between applicants of the same program. Whether grantees use the last 12 months of income or the last 30 days or a year-to-date calculation, grantees must use the same calculation for each household consistently. Grantees can't use the last 30 days for one household, the previous 12 months for another household, and the last 60 days for another one. This is frequently done to try and get a household under the income limit, and fluctuations between clients in calculating income is inequitable and strictly unallowable. Use a single method of income calculation and be consistent between clients. In some unique circumstances, and as an exception to a grantee's policy, a snapshot method may be applied. This means that the grantee calculates eligibility on the household income at the time of the application. This can be used when a household's income has recently changed drastically, or maybe they are fleeing domestic violence and leaving a job to do so. Such variation to the standard policy must be documented in the client file, and the grantee must have a policy and procedure in place when exceptions to the standard income calculation method are applied. The most accurate and equitable income calculation is a year-to-date method, and it is preferred by OHCS. OHCS outlines a few circumstances in the manual to respond to frequently asked questions about income. Overtime and bonuses must be included as part of the household income. When a household has a live-in aid, the income that the aid receives would be considered part of the household's income unless the live-in aid is living in the home to assist an elderly or disabled person and that such care is essential. The aid is not obligated to financially support the household member. The aid would not be living in the home except to provide the services, and the client provides documentation of payment for their services. Such documentation is necessary to ensure that income can be excluded from consideration of the household income for the live-in aid. Tax credits, tax refund, and stimulus payments afforded by the government are not considered as part of income. When a client is self-employed, grantees must document the client's income through the client's previous year's tax information, such as a Schedule C of their Form 1040. Be sure that such income source is adequately documented. When providing assistance to a household that is unstably housed or Category 5, and when not using the 30% income rent ratio or the FMRs, grantees must document that the household lacks the resources to obtain or retain permanent housing. This means that grantees must document assets that may be available to the household to meet the need. While there is no asset limitation, if income is derived from such assets, such as digital currency, dividends on investment, etc., then grantees need to document the asset's income as unearned income, and it does count towards the household's total income. Self-certification is most likely the form of documentation grantees would use for this unearned income. It is also important to remember that assets that can be liquidated should be prior to using state funds to cover the need. This does not mean that if a household has a single car that they're required to sell the car before receiving services, but if a client has 5 cars, then yes, they probably should be looking at trying to sell a few of the cars to meet the need rather than using limited state resources. EHAP General Fund, DERF, ERA, and SHAP all do not have any U.S. citizenship requirements. While these programs also do not have any specified time frame identified as to how long they must have lived in Oregon prior to requesting benefits, to obtain OHCS program benefits and services, they must currently reside in Oregon, and they should intend to reside in Oregon for the remainder. The one exception to this rule is when a client is actively fleeing domestic violence and funds are used to relocate the client to another state that is safe. However, when using this allowability, grantees must document that the out-of-state location is a safe destination for the client and that the housing is available at that location, and funds can only be used for the moving costs needed to move the client out of state, such as hiring a moving van or movers. No vendor outside of the state of Oregon can be paid using OHCS HSS program funds. More information will be provided on this later when we talk about the allowable costs. This brings us to the allowable uses of funds. Again, please note that there is general guidance in the HSS program standards guidance that must be followed when paying for allowable uses of funds. Street outreach must serve unsheltered people who do not otherwise seek assistance. This involves going outside of the agency to connect with households in areas where unsheltered people reside. Street outreach dollars must be expended to build rapport and meaningfully engage with the unhoused population in an attempt to screen them for eligibility and provide them with case management services. The intent is not to provide services to make them comfortable living outside, but the focus must be to move unhoused individuals and families into permanent housing. OHCS encourages grantees to use a multidisciplinary approach and partner with other organizations that can assist the unsheltered population. Subgrantees must have written policies and procedures for how safety will be maintained for outreach workers when delivering services. More information about what should be included in that policy is available in the manual. OHCS recognizes that as a function of building rapport and reaching unhoused populations, grantees typically provide consumable purchases, such as food, tarps, sleeping bags, clothing, blankets, toiletries, etc. However, it is stressed that such purchases must be a means of encouraging program participation, and the goal is to connect unsheltered households to services, case management, and ultimately permanent housing. It's important to recognize that such purchases are not meant to just make unhoused people comfortable living and staying on the street. If it is evident that engagement into program services will not occur, the continued delivery of consumable purchases should not continue. Again, the intent is to engage with and build rapport so that the unhoused population can obtain housing, and OHCS funds are not intended to be used to provide ongoing support to live outside. When using funds for consumable purchases, be sure to document efforts taken to use other resources and donations first prior to using OHCS funds for such purchases. Documentation must be available or information satisfactorily articulated in OHCS's monitoring that state funds are limited and must be used effectively to meet the intent of the funds, which is to ensure that unsheltered people obtain permanent housing. So we want to be sure that we are documenting those efforts to obtain those other purchases first so that we can make the best use of our dollars. The category of street outreach cannot be used for a client. A client has been screened, is determined eligible, and is receiving rapid rehousing assistance. Street outreach is only for those who are not yet clients. Additionally, it's important to understand that at no point is the use of gift cards or other cash equivalents, such as a prepaid laundry card, allowable in street outreach. When an organization has an OHCS approved gift card policy, such use of gift card can only be used for the benefit of clients, and street outreach services are only available to non clients in order to build rapport and bring them in and make them clients. So gift cards or cash equivalents are unallowable in street outreach. Aside from consumable purchases, the use of street outreach is just largely a staffing expense and considered program delivery. Note that unallowable costs include cash or cash equivalents, use of vouchers or gift cards, stipends or direct payments to individuals for any purpose, personal solar or other powered generators, and phone purchases for individuals are unallowable. Phone purchases for street outreach workers is allowable. Additionally, veterinary or animal behavioral health services is unallowable under street outreach, but can be provided within the emergency shelter operations category for clients. So let's move on to emergency shelter and transitional housing operations. The emergency shelter and transitional housing operations is literally meant to keep the doors open in these facilities, and the allowable costs are associated with maintaining and operating the facility itself. Related client program delivery services and financial assistance designed to move clients out of these facilities are covered under rapid rehousing activities, and they are not a part of operation costs. Shelters act as a front door to unsheltered people so that they can connect to a system of care that will provide them with emergency services such as immediate hygiene needs, meals, and a safe place to sleep. Shelters may be congregate or non congregate. Shelters must provide space to live and sleep and securely store belongings, which includes prescription medications. They must include kitchen or meal prep facilities. They must include bathrooms and be free of trash and debris and receive regular cleaning and disinfection of common areas. Shelters must properly dispose of hazardous waste such as needles and sharps and must provide refrigeration for required prescriptions needing such refrigeration for residents or a resident's pets. Shelters cannot charge residents a fee for any shelter service. The building must meet standard habitability requirements. This is not meant to be an HQS or an Inspire inspection, but habitability inspections must be performed minimally once every funding cycle. Shelter staff can perform the inspection to ensure that there is appropriate access, air quality, water supply, sanitary facilities, illumination, fire safety, etc. Air quality and water quality checks are not meant to be cumbersome. More information on the habitability standards can be found in the manual, and there is a habitability standards checklist and certification form for documentation purposes that can also be found on our website. Ensuring that shelters are low barrier is a priority at OHCS, but is not identified as a requirement. Low barrier shelters allow sheltering without preconditions of sobriety, allow for pets, allow for families to shelter together, and comply with equal access regardless of gender. Sheltering can also include hotel-motel stays in areas or times when there is no appropriate shelter facility or when needed to meet a specific household's medical needs. When using hotel-motel stays for shelter, grantees must have documentation on file that identifies the due diligence performed to determine that no other emergency shelter is available or that a client met the need for non-congregate sheltering options. When using hotel-motel vouchers, grantees are not required to perform habitability standard checks on those units. Inclement weather centers may also be a form of sheltering and typically come into place when temperatures or a combination of precipitation, wind chill, and air quality become dangerously inclement. The paramount purpose of an inclement weather center is to prevent death and injury from exposure to the elements. When OHCS funding is given to an inclement weather center for their operation needs, such organization must be identified as a recipient or subrecipient and be prior approved by OHCS through the funding application. Additionally, the resulting contract of such funding relationship must contain all the required provisions from the OHCS award to the grantee. These centers must comply and operate within the requirements of OHCS funding. Freestanding temporary shelter is also a sheltering option. These are commonly known as tiny homes, pallet shelters, or Conestoga huts. They do not typically include a foundation, but they are physical shelters. If funds are used to purchase such units, the purchase must be prior approved by OHCS regardless of the cost and the pre-approval form is available on our HSS dashboard. There are habitability standards for such shelters that include heat and electricity in each unit, walls and a roof, and the ability to close and lock the unit's door. Additionally, the area in which freestanding temporary shelters exist must include showers and toilets on site, have potable water, receive regular cleanup of the site location, which includes garbage collection and the ability to dispose of sharps and other biohazard. It must include food preparation facilities, or there must be an action plan for how such shelter residents obtain meals. Additionally, residents must have access to services, and the site rules must be posted at the site. And finally, another sheltering option is a safe sleep site. These are locations that provide unsheltered people a safe and lawful place to temporarily place a vehicle or a tent in which they are living. Such residents must have access to services. A safe sleep site strategy can be employed when there are no other shelter options available to meet the need of the unsheltered. Grantees must have documented evidence of an analysis that identifies a gap in the grantee's sheltering options that only a safe sleep site can fill. This could be a community needs assessment or other analysis. Such locations must adhere to local zoning requirements, and again, the end goal must be to connect residents to permanent housing. A written plan of operation for each site must also be documented. This may take the form of policies and procedures. However, such sites must have a minimal level of on-site management that ensures compliance with zoning requirements, ensures the safety of its participants, site cleanliness, garbage and biohazard disposal options, access to potable water, sanitation options such as portable toilets or access to toilet facilities, waste management that includes a plan to address spills and RV wastewater disposal, and must include a plan for the removal of inoperable or abandoned vehicles. Like freestanding temporary shelter sites, the site rules must be posted at the site and residents must have access to services. When any shelter allows for the housing of pets or companion animals, the shelter must have an animal safety policy or procedure that includes the type and number of animals that are acceptable. However, dog breed restrictions are prohibited and must include information on whether muzzles or leashes are a requirement, and if so, when and where. The policy or procedure must include information on the requirements for waste cleanup and what happens when the guidelines are not met. If there are kennels available, the policy must include rules to use them. If there is any requirement for the cleanliness of the animal or any proof required of current vaccinations, such as a requirement, must also be identified. And finally, the policy must include the process for addressing pet aggression behavior or other pet concerns raised by staff or residents. A policy template is available on the MGA dashboard to assist in the development of an animal safety policy or procedure. When a shelter allows for child care services for residents in the shelter to attend meetings, appointments, or do job search, there are additional requirements. Shelters can become licensed to provide child care under OAR 413-215, and more information on that can be obtained from that Oregon administrative rule. However, shelters can also enter into agreements with licensed child care facilities for drop-in child care services. Subgrantees must develop policies and procedures to address how they will provide child care services that mitigate liability and details when and how clients can access those services. A policy template is available on our MGA dashboard to assist in the development of an appropriate child care in shelter policy. Additionally, cost to board animals is also an allowable use of funds, as well as costs related to providing pet food, pet toys, pet licenses, and basic veterinary and behavioral services for pets when such services are not available or are inaccessible in the community, specifically for clients. Veterinary care is meant to be basic and cover items such as vaccination, flea treatments, spay or neuter operations, and is not meant to cover major operations. Funds can also be used to shuttle an eligible pet to and from the veterinary or boarding facilities. When using funds for shelter operations, it's important to keep some things in mind. If using a hotel motel strategy and a resident damages the unit, damages could be covered when they are reasonable and specifically itemized by the hotel or the motel facility. Reasonability is established when costs are aligned with similar costs in the area for the same type of damages and would include any depreciated value of the product. For example, an older hotel that hasn't updated their carpet in 15 years could not charge the subgrantee for damages to the carpet, as such item would have been fully depreciated in value and would be considered unreasonable. Access to Wi-Fi is also allowable in hotel motels, whether it is a part of the room fee or even if it is charged separately. However, no other incidental costs are allowed, such as room service, long distance or fee-paid phone calls, movie rentals, etc. When using OHCS funds for shelter, a bed inventory must be entered into and remain current in HMIS. Transitional housing is also a form of sheltering and provides temporary housing to unsheltered persons and includes a supportive services component. Transitional housing can be used to house people for up to 24 months and requires a lease or an occupancy agreement. Transitional housing is meant to be temporary, and there must be a clear plan of action to move the client into permanent housing eventually. Transitional housing is different in that it is designed to assist clients in becoming self-sufficient, and because of that, a rent can be charged to the resident. The rent must be reasonable and comparable to other similar units, and the rent charged to the resident must be based on their income. However, OHCS funds cannot be used to pay the tenant's share that is expected of them to pay for rent. Additionally, the same habitability standards that apply to emergency shelters apply to transitional housing. Finally, allowable emergency shelter and transitional housing costs are related to the operation of the facility. A table is provided in the manual that identifies when costs are allowable under emergency shelter and when they are allowable under transitional housing. Specifically, unallowable costs include the purchase of recreational vehicles as a form of shelter. Shelter and transitional housing funds can be used for the renovation or rehabilitation of shelters or transitional housing. There's quite a bit of information in the HSS Program Standards Guidance, so be sure to follow that guidance for specificity on when it is allowable and how to request prior approval before beginning any renovation or rehabilitation project. EHAP general funds can be used for both reno rehab of shelters and transitional housing, whereas SHAP can only be used for reno rehab of shelter facilities. Such use of funds must be pre-approved before incurring any expense, and grantees must follow the reporting requirements for this activity. Again, see the HSS Program Standards Guidance for more specificity. Let's move on to financial supports for clients. OHCS funds can be used for either prevention or rapid rehousing. It is important to recognize that while EHAP general funds and DERF funds can be used to support either prevention or rapid rehousing, ERA can only be used to support prevention costs, and SHAP can only be used to support rapid rehousing costs. Prevention is when a household status is either at imminent risk of houselessness, Category 2, or unstably housed, Category 5. Prevention assistance keeps a client in their current housing. Rapid rehousing is when a household status is either literally houseless, Category 1, houseless under other federal statutes, Category 3, or fleeing or attempting to flee domestic violence, Category 4. Rapid rehousing is designed to quickly move unsheltered households into permanent housing. Financial assistance are those costs paid on behalf of a client to meet the emergency financial need. Let's delve into some of those specific allowable costs. However, be sure to always refer to the operation manual for all information related to the delivery of OHCS funds. This training is meant only as a high-level overview. We will only cover some specific financial assistance activities, not all allowable costs. For specificity on which program allows which type of financial assistance, a handy table is available in the manual beginning on page 30 that provides an at-a-glance view of what costs are allowable under prevention and what costs are allowable under rapid rehousing. Always read the manual for clarity on what is allowable and what is not, and on any specific requirements associated with a specific cost. This quick table should never be used as the sole guidance of what is or is not allowable. It is for convenience only and not an alternative version of the manual. The largest expense usually paid by subgrantees is rent. Rent payments must be for a client's primary residence in which the lease or rental agreement is verified. Lease and rental agreements, if digitally signed, must follow the requirements of a digital signature. Rent payments can be a tenant's share of a housing voucher agreement. However, they cannot be used for the tenant's share of a transitional housing agreement. Rent payments should always be made to the landlord and not the tenant directly. Mortgage payments, inclusive of property taxes, may also be allowable under EHAP for a client's primary home. However, this does require third-party documentation, and it cannot exceed 6 months of assistance and must be for the purpose of avoiding foreclosure. OHCS funds are not intended to build assets. However, to avoid foreclosure and entry into houselessness, there is a limited ability to provide such assistance. Additionally, a rent or lease to own agreement may be allowable. However, there must be documentation of the agreement, and it must identify how much of the monthly payment is for rent and how much is for the equity or interest or tax payment. Unlike a mortgage payment, OHCS will not pay the portion related to the purchase in a rent or lease to own agreement, as there is no guarantee that a purchase would occur and would be considered asset building. However, OHCS could pay the rent portion of the agreement to avoid eviction. Rent arrears is also allowable. However, this is restricted to 6 months of past due rent per calendar year. A copy of the lease or rental agreement may be needed in order to determine that any lump sum does not exceed the 6-month limitation. Again, any past due amount related to the equity, interest, or tax payment of a rent or lease to own agreement would not be allowable. Subgrantees can further limit arrears amounts to less than 6 months based on funding availability. However, such restrictions must be applied consistently, and the subgrantee must have a policy or procedure in place that identifies the restriction. When considering rent arrears for a client that owes money to a previous landlord, whether related to rent, property damage, late fees, court fees, etc., such costs are allowable, but only when there is written evidence that the prospective landlord requires the payment of such costs to the previous landlord before they will execute the rental agreement. Funds cannot be used as a barrier buster, as this is the equivalent to paying consumer debt, which is unallowable. Only when a prospective landlord requires such payment to the previous landlord in writing is this allowable. Additionally, housing modifications such as temporary ramps or grab bars or rails to assist physically challenged households are allowable. However, when used in a rental home, such devices must be able to be removed without creating damage to the property. Storage fees under a rapid rehousing program are allowable. However, it is limited to 3 months of rent, and the household must be actively awaiting placement in their permanent housing. These costs are not allowed under prevention. Moving costs within the state of Oregon may be allowed, such as a rental of a moving van or if a client with a disability needs assistance with movers. It is unallowable to use cash, gift cards, or cash equivalents for the payment of such expenses. Such costs do not include cleaning of the unit that a client may be leaving or disposing of trash or furnishings. No vendors outside the state of Oregon can be paid using these program funds. Transportation costs such as a bus or train pass, gas vouchers, costs related to Uber or Lyft or cab fares are allowable and are the priority for transportation expenses. Transportation expenses must be for the purpose of attending required appointments, job search, or other critical services. Again, this is not meant to be a barrier buster strategy. Case managers have discretion to provide for the repair of a client's personal vehicle, which includes costs related to fuel and insurance. However, they must document why a client's personal vehicle is preferred over public transportation options. For example, repair of a vehicle may be preferable to a bus pass if the area does not have a bus system or if the client works at night when public transportation is not available. If covered, only costs associated with a vehicle in which the client is named as the title holder and for which they have a valid driver's license can be covered. To cover costs associated with a client's personal vehicle, subgrantees must have a private vehicle cost policy. More information on the policy is provided in the manual. It's important to remember that transportation costs do not include insurance to pay for roadside assistance, such as AAA, nor does it cover traffic violations or collection costs associated with traffic fines. Additionally, only a general liability coverage at the minimum required by the state of Oregon is allowable for insurance coverage. Comprehensive and collision coverage can only be allowable if such coverage is a requirement of a vehicle loan. Remember, in Oregon, insurance is paid before the period of service, and therefore insurance arrears is not a factual cost, and it is unallowable. Food to assist a client with emergency needs is allowable under both prevention and rapid rehousing. When used in prevention, the costs are limited to one time per fiscal year, and when used in rapid rehousing, the benefit is a one-time benefit when placing a person into permanent housing. The maximum amount that can be allowed is equivalent to 1 month of SNAP benefits as determined by the USDA, is it USDA or DHS? And the link to that website and the information is available in the manual. Additionally, clients receiving the benefit must be connected to SNAP if they are not already receiving SNAP, and if needed, assistance must be provided to the client to help them apply for SNAP benefits if they need that assistance. Subgrantee must document why other food sources such as food boxes or other assistance is not available to meet the need. Additionally, such benefit must not be provided through a gift card or cash equivalent unless the subgrantee has an OHCS pre-approved gift card policy. Use of funds for the purchase of clothing is extremely limited to clothing needed for employment or when fleeing domestic violence in which there was not an option to leave the home with their clothing. Clothing is specifically defined in the manual, unless it is for the purpose of fleeing domestic violence, in which clothing could not be taken at the time, it means a specified article of clothing, such as shoes, boots, hats, shirts, slacks, skirts, or outerwear for an employee and required by the employer to perform the functions of the job or provide a distinctive and easily identifiable appearance in performing his or her job, and is not covered by a uniform allowance. If using funds for clothing purchases, the subgrantee must document why other donations or community resources are not available to meet the need. Finally, in rare cases, a cost may not be identified in the manual, and a client has a non-categorical service need. Such expenses are for the provision of goods or payments which directly help a household to obtain or maintain permanent housing or meet a unique essential need. Such expense must be fully documented in the client's service or housing plan and must be connected to housing stability. Consumer debt payments are not an allowable cost as a client's non-categorical service expense. Additionally, such expenses cannot be paid cannot be paid with a cash or cash equivalent payment such as a gift card. Prior approval by the case manager supervisor is required before such a cost can be covered. Again, this is not a barrier busting strategy or an opportunity to cover an expense that would be prohibited. An example may be an elderly client runs out of insulin and is unable to reach their physician to refill their prescription, but needs to purchase a vial of insulin in order to survive and cannot wait a day or more to speak with their doctor. Such costs may be allowable. If grantees have any questions about the allowability of any client non-categorical service, please reach out to us directly. A final note about gift cards. Gift cards are allowable, however, grantees must have a pre-approved gift card policy prior to the purchase of even a single gift card with OHCS funds. Any gift card purchase prior to the approval date of a gift card policy will be disallowed in monitoring and require repayment. The rare use of gift cards literally means very unusual or not occurring often. It's not rare if 10% of your of the grantee's clients are receiving gift cards. Look to other methods of providing services, such as partners with services that will bill for a client's expense or institute a voucher system. Grantees can also make purchases online and or through a company credit card that tracks the type and amount of purchase and then given to the client. Many more information on gift cards and the requirement for a gift card policy can be found in the manual. I know this is super tiny print and you really can't read it very well, but I'm only sharing it in this training to highlight the fact that these costs are all allowable under financial assistance. This guide is available on page 30 of the State Homeless Funds Operation Manual. Again, always be sure to read the details related to each allowable cost, as some require additional documentation or have specific limitations. Again, this is not meant to act as an alternative to the manual, but only as an additional tool. This table lists the allowable financial activities and whether the activity is allowable under a prevention program or under a rapid rehousing program. This matters based on the funding source. For example, ERA cannot be used for any activity related to rapid rehousing, and SHAP cannot be used for any activity related to houselessness prevention. If the wrong program is used for an expense and uncovered in monitoring, subgrantees will be required to repay or rebook the unallowable cost. Be sure you're always following guidance. I also want to cover just briefly that we get frequently asked questions all the time and for what is or is not allowable. And to assist you in determining the allowability of a cost, we also provide a list of unallowable costs in the manual. On the screen are such costs for which we have provided information in the past and found it important enough to include for your reference. If you have questions on a cost, this could be a quick place to look to see if it had already been determined on whether or not it was allowable or unallowable. But if you still have further questions, please feel free to reach out to us. Let's pivot now to program delivery. Program delivery is generally the staffing costs associated with providing services to either clients sheltered or unsheltered and or through prevention or rapid rehousing programs. These costs are necessary to provide eligibility determination services and case management, and costs may be associated with providing meals in a shelter, financial or budgeting education services, housing navigation, mediation with landlords, tenant readiness education, connecting clients to other resources and programs, and or providing warm handoffs with counseling, mental health, or addiction services. Costs may also be attributable to HMIS, such as data entry, data reporting, data mining, or analysis, or associated with the user licenses, equipment upgrades, or training and technical assistance. Costs may also be associated with providing inspections related to habitability. Program delivery costs may be direct, but they may also be indirect costs based on the grantee's cost allocation plan. Costs should be clearly documented and supported in the grantee's request for funds. Unallowable program delivery costs include food, candy, treats, and gifts for employees. I briefly want to cover a couple of other allowable costs that are identified as specific categories in OPUS and require quite a bit of documentation for their allowable use. First, OHCS allows subgrantees to use funds to compensate EHAP General Fund clients for their lived experience, either through surveys or through focus groups or feedback sessions. It is critical that funds be provided only to EHAP General Fund clients. Again, the definition for client is one who has received an assessment of need, has been entered into an OHCS funded program, entered into HMIS, and is receiving financial assistance. Only when they are receiving financial assistance are they considered a client specifically for the purposes of engagement incentives. Remember, this allowability does not extend to any other funding source. It does not extend to DERF Vet, ERA, SHAP, or any other OHCS HSS program. Surveys and feedback sessions must be housing related and needed to inform grantees and the grantees community of needs related to houselessness. If the survey or focus group incidentally discusses related topics such as food scarcity, public safety, and public health, that is permissible as long as there is a housing connection. Gift cards can be used to provide the incentive to $25. However, grantees must have an engagement gift card policy prior approved by OHCS before beginning to engage with any client and paying them a $25 compensation. It is important to recognize that a general gift card policy does not provide the same permission for the purpose of survey and engagement compensation. While the policy related to gift cards generally and the engagement compensation could be included in the same policy, they are distinctly different and each requires specific language. As is the same with regular gift cards, the acknowledgement of receiving the gift card must always be in a face-to-face interaction. Gift cards, whether for engagement purposes or any other purpose, must never be mailed. For the purpose of surveys, documentations must be kept on file that identifies what EHAP General Fund population was targeted, why, and the method used to solicit their participation. The survey must focus on specific program or policies designed to address houselessness and housing instability. These cannot be customer satisfaction surveys. Clients must be provided sufficient context regarding the purpose of the survey and how their results will be used. They must have in-depth questions that influence program design, expansion of existing services, or identifies gaps in services. Written records must include the client's legible name and address. However, if they are houseless, they can state that fact. And surveys cannot be open-ended. They must have a beginning and an end date that does not exceed a period of 60 calendar days. Additionally, the subgrantee must document how the responses were used and the outcome of the survey. Employees are not eligible for engagement compensation, and the allowability of funds for this purpose does not extend to subrecipients. It may in the future, but since this is completely new, we are starting small and we will reassess as we roll it out. Compensation is limited to a one-time payment for survey participation per fiscal year, and the subgrantee must have policies and procedures in place to ensure that this limitation is not exceeded. Grantees must retain all documentation related to survey compensation for a period of 6 years from the close of the survey. Focus group and feedback sessions engagement is very similar. However, there are a few differences in the documentation requirements. Sessions may be a single session or they can be a limited series of sessions, such as meeting once a month over a period of 6 months. Again, the compensation can be paid each day the EHAP General Fund client participates in a session. However, the total amount provided to any single client cannot exceed a total of $300 in a fiscal biennium. Clients must not participate in more than one engagement opportunity, whether a single session or a series of sessions per biennium. Again, grantees must have policies and procedures on how grantees will track this. Documentation is similar to survey opportunities. However, because a survey is a one-time event and a focus group or work sessions may cover multiple sessions, records must include dates, times, and locations of the sessions, minutes or notes from each session, and similarly to survey, include why specific clients were targeted and the method to solicit their participation. Receipts of gift cards must be in face-to-face interactions, which includes a written, legible, wet signature and date, and the acknowledgement in writing that they are engaging as an independent contractor and not as an employee. Since this is a new allowability, be sure to carefully read all the guidance and requirements as outlined in our manual. Let's touch on the newly named category for the allowable use of EHAP general funds, called Emergency Systems and Strategy Strengthening. This was previously called community capacity building. However, the term community capacity building has been used in many other areas of OHCS and reflects many different concepts and ideas, and there is no longer a term that accurately describes the allowable use of EHAP general funds. So while this allowable use didn't change significantly from the last biennium, I want to point out some very specifics. This use of funds is intended to enhance the local houselessness system, to design and implement strategies to build, rebuild, and sustain an emergency housing system. This is meant to increase the capacity of the system to address houselessness. This is not meant to increase an agency's capacity. It is also not meant to address disaster recovery efforts. This is not just another category that you can use for program delivery or admin needs. ESSS is meant to increase the range of funders and potential contributors to the houselessness system, assist organizations in developing networks to undertake joint activities, enhances skills and resources in joint efforts with the system, and ultimately designed to increase the access of services to those in need. This is not just simply sharing program information with other organizations, such as a marketing or outreach effort. This is meant to truly be a specific project with a beginning and an end to address the needs and strengthen the strategy of the emergency houselessness system. All ESSS projects must be prior approved by OHCS before the expenditure of any funds. Grantees will need to provide specific outcomes and deliverables, name partnerships, and identify charters, memorandums of understanding, or other agreements, increase service capacity in their system, identify grantees' method of evaluating the project, have a specific budget that details leverage resources and the breakdown of staff, materials, transportation, hardware, software purchases, as well as what specific staff and FTEs will be involved in the project. There is a list of project types in the manual, such as developing a funders table or community house list tables, collecting and analyzing systems to create streamlined approaches to addressing houselessness, or through system mapping of existing housing and services throughout the region. Many examples are provided. If grantees desire to use funds in this way, grantees must submit a separate smart sheet that identifies the use of funds, and the funds must be budgeted to the ESSS category. Again, more information is available in the manual. This takes us to the financial management section. Once again, please be sure you and your subrecipients are following all the HSS program standards identified in the HSS program standards guidance, such as fiscal standards. For EHAP General Fund, DERF, ERA, and SHAP, the administration costs are limited to 15% of the total allocation. You can always budget less than 15%, but you can never budget more than that. Administration refers to costs that benefit the entire organization and cannot be attributed specifically to a particular program, such as executive and board member compensation, IT and HR salaries and compensation, and the operation of the facilities. This may include direct or indirect costs. Indirect costs must be in accordance with the organization's written cost allocation plan or the negotiated indirect cost rate agreement, the NICRA, and must consistently be applied to all programs in the same manner, whether funded by OHCS or not. While we don't provide specific details for what is or is not a direct or indirect cost, we do provide some general guidance in the manual. Costs associated with the closeout of a grant can be included when incurred, but must be liquidated prior to the due date of the financial report, August 30th. Closeout costs include costs associated with completing the final report, submitting final requests for funds, and closing the books within grantee's organization. This does not apply to any other category of funding, only to the admin category. All other categories of funding must have incurred their last expense by the end of the performance period or June 30th. Unallowable admin costs include late fees assessed due to a subgrantee or subrecipient's failure to pay bills in a timely manner, and a subrecipient or subgrantee's facility mortgage payment, and any lobbying efforts. So let's pivot now to other aspects of financial management. The spend down of funds is being much more closely monitored, and the scrutiny will continue into this biennium. This is needful as OHCS is expected to report to the legislative body and the governor's office whenever there are questions about how quickly the funds are being expended. If grantees are unable to adhere to the standard spend down plan, they can request a time-bound expenditure plan that requires prior approval by OHCS through the submission of the implementation report. The standard spend down plan is the expenditure of funds drawn from OPUS. 10% of the funds in the first quarter, 25% in the second, 60% in the third, and 90% of the funds by May 31st of each year. The May 31st date is actually 90% of the way through the fiscal year, so the remaining 10% would be expected to be drawn by June 30th or during the closeout period of the grant. The spend down plan tracks only the amount of funds that is drawn from OPUS and does not include any obligation or commitment of funds. Grantees will notice that the MGA program elements for HSS funds require that funds be drawn from OPUS once every 60 calendar days or sooner for every program. This will help grantees stay on track with their spend down plan and ensure that funds are expended during the performance period. OHCS has moved away from an individual state grant award in the biennium to avoid rollover issues mid-biennium and to allow grantees the flexibility to expend the allocated fund throughout the entire performance period. While grantees will still receive an additional allocation of funds in the second year of the biennium, this will not be a new grant with a new grant name in OPUS, but will just be an additional allocation of funds in the existing grant. However, any funds not drawn by 60 days following the funding period will be recaptured by OHCS, and any expenditures not meeting an approved spend down plan are subject to rescission at any time in the biennium and at OHCS's sole discretion. Regardless of where we are in the biennium, if a grantee fails to meet their spend down plan targets, OHCS may recapture those funds in a timely way so that we can reallocate them and ensure the full expenditure of the funds. Exceptions to the recapture of funds is not guaranteed. An exception request must be received by OHCS prior to 60 days to the date the FSR is due, and such requests will not be granted for reasons of late invoicing by subrecipients or a grantee's lack of adequate staffing. OHCS acceptance of an exception request will be at the sole discretion of OHCS. Now let's discuss flexible ways to use funds. EHAP General Fund can be used to meet match requirements of federal programs for services and financial assistance. Such federal program must target low or very low income households, and the intent of the federal program must be to address houselessness or housing instability. Using OHCS funds as a match is not the same as supplementing another program. EHAP General Funds is frequently a match source for both ESG and HSP. Supplementing another program can occur only with EHAP General Funds and SHAP funds and must be for the purpose of supplementing another OHCS program or a COC project. Similarly, using EHAP General Fund or SHAP as a supplement to other OHCS programs or COC projects means that those supplemental programs must have the intent of serving the needs of low or very low income households who are houseless or unstably housed. Supplementing needs to use funds to increase the available services and funding for a particular program by incurring certain costs that can be allocable to those programs. Replacing funds means completely eliminating or supplanting the use of funds from another program with EHAP or SHAP, and replacement of funds is unallowable. EHAP General Funds and SHAP are not meant to take over all the costs of another program, effectively eliminating the need for the other program to bear those costs. EHAP General Fund and SHAP must always be used in a manner that builds upon another grant and does not supplant or take over the work of an entirely different grant. For example, EHAP General Fund could not be used to pay all the admin costs of an ORDAP grant, as that would be replacing the funds. However, if ORDAP only allows 10% of their allocation for admin and the agency needs 15% to operate, EHAP General Fund could supplement ORDAP by paying the additional 5% of admin costs. Supplementing other programs, OHCS programs or COC projects requires prior approval by OHCS through the grantee's funding application. Grantees cannot spend any EHAP General Fund or SHAP funds in other OHCS programs or COC project without first receiving the prior approval, and such approval cannot be the means to cover costs incurred prior to the approval. For example, if approval is given on July 29th, no costs between July 1st and July 28th could be covered. Additionally, if the activity being supplemented requires prior approval from OHCS, such as a vehicle purchase or for rehabilitation of real property, EHAP and General Funds and SHAP cannot be used for that activity until such approval has been given in the other OHCS program or COC project, if applicable. For example, a van is needed in the ORDAP program, and EHAP General Funds will help to supplement the cost of that van. EHAP General Funds could not be used to supplement the cost until OHCS provided approval for the purchase of the van using both ORDAP and EHAP General Funds. Subgrantees must document their rationale for when and how EHAP, General Fund, and SHAP will be used to supplement the cost of other OHCS programs or COC projects through a reasonable basis within their cost allocation plan. Activities related to the supplemental use of funds are required to be reported in the grantee's annual report, and documentation must be kept on file of the cost allocation plan that details the use of the EHAP General Fund and SHAP funds in this manner. So let's pivot now to data collection, data entry, and data reporting. This hasn't changed since the last biennium, but do please follow the guidance for these elements as detailed in the HSS Program Standards Guidance. Subgrantees and their subrecipients must adhere to the more stringent of either the COC's HMIS Data Quality Plan or OHCS's data standards. There are specific standards around data entry for emergency shelters and other program components, so be sure you're following the requirements outlined in the HSS Program Standards Guidance. Remember, the subgrantees must submit complete and accurate materials requested by OHCS by the deadline provided by OHCS and in the form and format required. Any submission that is incomplete and or does not meet accurate information is submitted after the deadline will be considered by OHCS to be late and out of compliance with requirements. Failure to provide required data or reports can result in an audit finding in the monitoring report and other remedies as afforded in the OHCS grant agreement or contract. Costs related to such activities are a program delivery expense. Record keeping is also unchanged from the previous biennium. However, be sure that you are keeping records for a period of 6 years from the end of the grant performance period, and be sure that you are not only keeping records, but that you are destroying records after their retention period in accordance with the requirements as stated in the HSS Program Standards Guidance. Records must be maintained securely and in accordance with the requirements and must be accessible by OHCS or any OHCS designee, such as the Secretary of State's office or other auditor. Retention schedules can be found in the HSS Program Standards Guidance for EHAP, ERA, and SHAP, as well as other OHCS programs. Also, remember that a client service or housing plan is required for those participants receiving more than one-time only services or is needed according to the type of activity being performed that requires a case plan, and such plans must be kept in the client file. It could be helpful to develop a participant file checklist of documentation required to be maintained in the client file. However, all documents related to eligibility and assistance provided must be maintained in accordance with the requirements outlined in the program manual and the HSS Program Standard Guidance. Drop-in or mass shelter facilities that provide bed nights and no case management must minimally maintain sign-in attendance documentation that includes shelter resident self-certification of their houseless status. All other shelter provisions, including issuance of a hotel-motel voucher as part of a shelter strategy, it requires that participant eligibility documentation be maintained in the participant file. As a final note, each OHCS manual includes a page that identifies all applicable laws and rules for each program, as well as relevant definitions. Grantees must ensure that they are following all rules and regulations in the program guidance. Definitions are meant to assist grantees when there are questions with how a specific term is identified. For example, OHCS clarifies what clothing means as an allowable expense by defining it as unless for the purpose of fleeing domestic violence in which clothing could not be taken at the time, clothing means or articles of clothing, in other words, shoes, boots, hats, shirts, slacks, skirts, or outerwear for an employee and required by the employer to perform the functions of the job or provide a distinctive and easily identifiable appearance in performing his or her job and is not covered by a uniform allowance. For example, Walmart requires that employees wear a blue polo type shirt and tan colored pants. If a client has obtained a job at Walmart and is unable to purchase such clothing, EHAP General Fund could be used to assist a client with that purchase. So that wraps up this program training. Don't forget to use the HSS dashboard. It really does have a lot of helpful tools and tips and is frequently updated. I recognize this is a ton of information. However, feel free to rewatch this at any time. It will remain available on our dashboard for the biennium. You may also connect with us at any time if you have questions by contacting our gatekeeper at the email address shown on your screen. Thank you for watching and have a great rest of your day.